Hi Isabel, how are you today?
Good, how are you?
I'm good. Today I'm going to be doing a comprehensive assessment on you. Is there anything I can get you before we get started? No? Okay. First thing I'm going to do is ask you some questions. Do you have any allergies?
Peanuts and tree nuts.
Peanuts and tree nuts? And what kind of reaction would you say you have to those?
Anaphylactic reaction.
An anaphylactic reaction? Any other allergies?
Dust.
Dust? And what kind of reaction do you have to dust?
Just like sneezing and coughing.
Sneezing and coughing? And how tall are you?
5'4".
5'4"? And how much do you weigh?
130 pounds.
130? And do you know your BMI? No? That's okay. Have you had your pneumonia immunization?
No.
What about your flu? Have you had the flu shot? Yeah? Do you know when you had your flu shot?
Last year.
Last year? Do you know what month or anything or no?
May, I think.
Have you had your tuberculosis shot?
No.
Shingles?
No.
No. Have you had any other immunizations?
Chickenpox.
Chickenpox? And when did you get that?
When I was like 2.
When you were like 2?
When I was little.
Okay, now I'm just going to ask you some questions about your family health history and you, so it pertains to you and your family. So, do you or your family have any history of arthritis?
No.
Do you or your family have any history of blood, such as anemia or clotting or excessive bleeding or blood transfusions? Any history of cancer?
No.
Diabetes?
No.
What about vision problems? Does anyone in your house wear glasses?
My dad wears glasses.
Your dad wears glasses? And does he, do you know if he's nearsighted, farsighted?
He's nearsighted.
Nearsighted. And you don't have any problems with your vision?
I'm farsighted.
You're farsighted? And do you do anything to treat that?
I wear glasses when I'm on the computer.
When you're on the computer? Any hearing difficulties?
Nope.
Nose or throat problems?
Nope.
Cardiac problems?
I have a leaky heart valve.
Leaky heart valve? Has anyone in your family had like a heart attack or?
My grandpa did.
Your grandpa had a heart attack? Do you remember when?
It was last October.
And how did you treat that, or was it not treated?
He died.
He died? Okay. And do you or your mom do anything about your leaky heart valve? You get like scanned or?
Yeah, we get a cardiac scan.
And how often do you get that?
Annually.
Okay. Does anyone in your family or you have a history of high blood pressure?
No.
No? Any respiratory issues such as asthma, bronchitis, emphysema?
I used to have asthma.
You used to have asthma? Do you remember when?
When I was 3.
When you were 3? And did you outgrow it, or do you still currently have it?
I outgrew it when I was like 10.
When you were 10? And what did you treat your asthma with? Did you use an inhaler? Yeah. Any history of a stroke?
No.
No. Any history of peripheral vascular, such as diverticulitis, lymphedema? Any GI or abdomen problems?
No.
Any neurologic problems?
No.
Any history of musculoskeletal problems? Maybe someone in your family uses a walker or wheelchair?
No.
No. Any skin, hair, nail problems?
No.
Any history of chronic infection?
No.
Any history of a psychological or mental disorder such as depression or anxiety or no? Any alcohol use?
My parents do.
Your parents? Do you know what type?
Like whiskey.
Whiskey. And how often would you say that they drink a week?
Probably like once or twice.
Once or twice a week? And how much would you say? Like a shot glass, since you said whiskey, like a shot glass or just a standard drink or something? Any history of drug use? Any history of smoking in your family or you?
No.
Okay. Any other diseases or? No. Okay. Now I'm going to get your vitals. I'm just going to place this right under your tongue. Okay. 98.6. Place this one under your arm. Sorry. Sorry, it's a big cup. I'm going to have you hold this for me if you would. Okay. Thank you. I'm just going to borrow your hand. I'm going to listen to your pulse. Okay. You can relax. If you're curious, your blood pressure is 120/60. Are you in any pain today? So would you say if you had to rate it on a scale from 0 to 10, you would be
0.
0? Okay. Now I'm just going to observe your skin. Put your hands out. It looks like you have 2 piercings in your right ear and 2 in your left. Do you have any problems with those? Any discharge or anything? I'm just going to take a look at your nails. Okay. Same thing with your feet. Okay. And borrow your arm again. Both arms, please. Okay. And okay. I'm gonna take a look at your head and your hair. And can you move your head side to side like you're shaking your head now? Up and down? And can you touch your ear to your shoulder without moving your shoulder up? Okay. And do your eyes. So can you just look like at the camera, and then when I put the pen up, you're gonna focus your eyes on that, okay? Okay. Just keep looking forward. Look at your ears. No problems with your ears, hearing problems, or Discharge. I'm gonna have you look up towards the ceiling and look in your nose. Okay, can you hold one nostril or close one nostril and sniff in? And do the same to the other. Perfect. And do your mouth. Can you open your mouth for me? Can you stick out your tongue and say ah? And can you put your tongue up towards the roof? Okay. And it looks like you have your tonsils, is that right? Gonna do your sinuses. Any pain with that? No. I'm just gonna listen to some of your breaths. Listen to your lungs. Okay, just take some deep breaths for me. Deep breaths. Can you pull here just a little bit? Okay. Deep breath. Deep breath. Okay, I'm gonna have you stand up. Take a deep breath in, and now let it out. Okay. Now same thing, just keep taking some deep breaths. Okay, you can sit down. Lungs sound good. I'm going to listen to your heart and check your carotid pulse. Okay. Can you lift your side, just your right side, a little more? Sorry. Okay, I'm just gonna count for a minute. Okay. Okay, now I'm going to have you lay down for me. It doesn't matter, whichever way you want to lay, whichever way is more comfy. Can you pull this up for me just a little bit? Someone? Can't even see belly button. Okay, I'm just going to palpate it a little bit. Okay, now take a deep breath in and let it out. Thank you. You can sit up now. Now I'm just going to test some of your range of motion. So the first thing I'm going to have you do is put your arms out and then push against mine. Okay. I'm going to have you pull my fingers towards you. Okay. Can you pull your feet against mine? Okay. And now go this way. Push your feet like a gas pedal. Perfect. Now I'm going to have you stand up for me. And can you bend down and touch your toes? Okay, can you walk to that door and back? Perfect. And now, hang on, don't sit down quite yet. I'm going to test your range of motion in both your arms and your legs. Okay? Same thing on this side. Okay, I'm going to have you sit down now. You could lay down actually. Whichever, you can lay that way, that's fine. Do the same thing in your legs. It's a little different. you turn that way on your side. Now turn the other way. Okay, now I'm going to do your feet, so if you could just kind of sit on the edge right here. It's perfect. Same thing in this one. Okay, perfect. We're almost done. Okay, now I'm just gonna have you close your eyes for me real fast. And hold out your hand. Can you tell me what this object is?
Pencil.
Okay, good job. Now keep your eyes closed. I'm gonna have you tell me what this smells like.
Hand sanitizer.
Hand sanitizer. Good. And what color is this?
Orange.
Orange. Good job. I'm just gonna have you follow the tip of this pencil with your eyes. Just keep your head still. Okay. I'm gonna have you bite down. Perfect. And this is a fun one. I'm gonna have you smile, frown, purse your lips, puff out your cheeks, squint your eyebrows, raise your eyebrows. Good job. And can you cover one side of your ear and tell me what word I'm whispering?
Soccer.
Okay, yeah, cover the other side.
Football.
Okay, perfect. Can you open your mouth for me? Say ah. Now I'm gonna have you turn your head one way, turn it the other way, and then shrug your shoulders. And can you stick out your tongue? Move it up and down, like there you go, and then side to side. Perfect. The last thing I'm going to do is check your reflexes, and we're done. You scoot kind of towards the edge just a little more, and then pull your hands apart. Really try, yeah, just like that. Okay. Okay. Good. Good. Okay. That was all I needed. Is there anything I can get you now? No? Well, thank you.